Good evening, guys. Tonight's discussion D deals with healthy longevity. Okay, so I'm going to discuss that with you tonight for D. So here we go. Healthy longevity is emerging as the defining public health project of the 21st century. A shift from treating disease late in life to cultivating the conditions for vitality, mobility, cognitive clarity, and social belonging across the entire lifespan. What follows is a full narrative rich essay that synthesizes the healthy longevity public health next frontier framework across research, education, practice, and policy. Okay, guys, the title is Healthy Longevity Public Health's Next Frontier. Healthy longevity is not simply the promise of living longer. It is the probability of living better with more years of independence, connection, purpose, and functional capacity as populations age and chronic disease burdens rise. Public health is being to read called to redefine its mission. The next frontier is not the prevention of single disease, but the extension of health span, the years of life lived in good health. This shift requires a new architecture for public health, one that integrates geoscience, community design, workforce training, and policy reform into a coherent life course strategy. The research imperative from disease silos to aging biology. For decades, public health research has focused on discrete conditions: heart disease, diabetes, dementia, each with its own risk factors and interventions. But geoscience has revealed a deeper truth. These diseases share common biological pathways of aging, including chronic inflammation, metabolic dysfunction, mitochondrial decline, and cellular sense. Healthy longevity research, therefore, shifts from disease specific prevention to targeting the underlying processes of aging itself. This includes validating biomarkers of biological aging, studying interventions that show functional decline, and building transitional pipelines that connect laboratory discoveries to community level practice. This research agenda demands collaboration across epidemiology, molecular biology, behavioral science, and implementation science, a unified effort to understand not only how people age, but how systems can help them age well. Education, workforce, education and workforce training for a longevity ready public health system. Healthy longevity cannot advance without a workforce prepared to deliver it. Public health, public health professionals, clinicians, nurses, social workers, and community health workers must be trained in aging science, functional assessment, prevention first care models, and anti ageism practice. This is not a niche competency, it is the new core curriculum. Embedding longevity principles into academic programs ensures that future practitioners understand mobility trajectories, cognitive resilience, metabolic health, and the social detriments that shape aging. It also prepares them, them to work in interdisciplinary teams, the only structure capable of addressing the complexity of aging across environments, behaviors, and biology. Practice building communities and systems where people can age well. Healthy longevity becomes real only when it is practiced in the in the places in the places people live. This means designing age-friendly communities with walkable streets, safe housing, accessible transportation, green spaces, and social infrastructure that reduces isolation. It also means integrating longevity oriented care models into health systems, biomarker informed prevention, strength and mobility programs, cognitive health promotion, sleep and stress uh, psychology coaching. Nutrition and metabolic health interventions, social connection incentives. These are not wellness areas, they are the upstream detriments of whether people maintain independence into older age. Public health practice must therefore shift from episodic programs to continuous life course support policy, creating the connections or conditions for health span at scale. Healthy longevity is ultimately a policy project. It requires governments and institutions to redesign the environments that shape aging. This includes age friendly urban planning, transportation systems that support mobility, housing policies that enable aging in place, funding streams for prevention and community health, anti ageism campaigns that reshape cultural narratives, cross sector governance, linking health, housing, transportation, education, and workforce development. Policy is where healthy longevity becomes equitable. Without structural investment, longevity becomes a privilege rather than a public good. The framework insists that every community, rural, urban, low income, marginalized, must have access to the conditions that support long, healthy lives. The unifying vision. Healthy longevity is not a program, it is a paradigm shift. It reframes aging as a dynamic, modifiable process shaped by biology, behaviors, environment, and policy. It calls public health to lead with science, design with empathy, and govern with a long horizon. A society committed to healthy longevity invests in children, supports adults, protects older adults, and builds environments where people can thrive at every age. It recognizes that extending health span is not only a medical achievement but a moral one, a commitment to dignity, independence, and possibility across the lifespan. Okay, guys, that is your shows for tonight. I'll jump back on later for things. So, I'll see everybody later tonight for at least one more. Um, Till then, Gator Wellness, take care, folks.